The name of my project in Brazil is Stop, Think and Dispose, and it's related to waste pickers' health, who worked in the largest open dump in the Latin America and the second largest in the world. We all know that the incorrect disposing of waste has huge environmental impacts and can cause serious problems to public health, especially for people who work with it. And according to the map in the right picture, you can see that most of these workers work in developing countries in bad conditions, and there are more than 1,500,000 of them around the world. They are called waste pickers or garbage collectors or solid waste segregators. In Brazil, we have almost 400,000 workers who are responsible for segregation and recycle of waste. In Brasilia, Brazil, the capital of our country, we generate 9,000 tons of solid waste every day, and there are about 2,500 waste pickers. Most of them worked in the open dump in bad conditions without safety. This open dump was the same age as our city, about 60 years of existence, and around this area there is a big city named Estrutural with 35,000 inhabitants who, most of them, or at least some of them, worked with something related to trash. It is the poorest city in Brasilia with the lowest socio-economic level. So these workers were exposed to chemical, physical, ergonomic, biological, and psychosocial risks. And in Brazil, we have a national law which forces every open dump to be closed until 2014, but unfortunately, we will still have 3,000 of them working around the country. And can you see the next slide with the picture of the chemical, environmental, and physical risks? It was not uncommon to see this kind of dangerous waste mixed with the common waste. So the waste pickers were exposed to all kinds of batteries, electronic waste, medicines, radioactive residues, and also to ergonomic risks because they carried heavy waste bags many hours a day, and also to biological risks with needles and glass and medical waste. A sad reality is the high prevalence of accidents that we found there, including being caught in processing equipment, being run over by mobile equipment, fires, explosions, being injured by glass, contaminated needles, medical wastes, and also death. So they were exposed to environmental risks too, with the possibility to have waterborne disease like dengue, Zika virus, chikungunya, hepatitis A, yellow fever, leptospirosis, and also intoxication by heavy metals, pesticides, and others. So in January 2017, the government of Brasilia asked us to do an epidemiological research survey about the waste pickers' health conditions before the open dump closes. So 1 year after our research, the open dump was closed this year in January 2018. So we are 14 professors working in this project and more than 30 students in the areas of health education, occupational health, environmental monitoring, epidemiology, health law, solidarity economy, medical waste, social inclusion, women's health, mental health, primary care, geriatrics, toxic metal exposure, water surveillance, and waterborne diseases. And the epidemiological diagnosis consisted in six steps. 3 of them we finished last year. The step 1, which was the identification of the subjects and schedule the tests. The step 2 was the realization of the questionnaire and the exams. And step 3, the return of the collectors to receive the results of the exams. And now we want to start step 4 to 6 to follow up with these collectors and their family and do other complementary tests, environmental assessment and monitoring with emphasis on water quality, and also do the correlation of the water quality with the waterborne disease. In 2017, we did the blood exams, anthropometric measures, and also the laboratory analysis. And now this year, in March 2018, we signed a document, an official agreement with the government of Brasilia to try to follow up with these collectors and continue these studies for the next years. So the step 2 was the reception of the waste speakers, the blood exams. We did biochemical tests, including serologies of HIV, syphilis, hepatitis A, B, and C, and anthropometric evaluation and vital signs with weight, height, blood pressure, and cardiac frequency, and also hair and nail collection to know about metal exposure. And then we finish this step with the interview. So in this picture, you can see the blood exams and also the hair and nail collection with the waste speakers. It was done in the health care center in the structural city with the primary care team, including physicians, nurses, and everybody who worked there. So this picture shows the anthropometric measures and the heart rate and the body mass index. Now you can see the questionnaire. It was divided into 7 topics, including demographic status, socioeconomic status, lifestyle, nutrition, work conditions, health conditions, and also access to the health service. It was 222 questions, and the interview was done face-to-face via tablets. So according to the government of Brasilia, there were 1,200 waste speakers who worked in the open dump, and we could do the epidemiological survey in more than 1,000 of them. According to our preliminary results about the socioeconomic and social demographic status, you can see in the highlight numbers that most of them were single, were female, were black or brown, and between the ages of 31 to 50 years old. Most of them had 1 to 3 children, and 35% between 4 and 13 children. The education level was so low, 32% of them were illiterate, and 50% had only elementary school level. And 76% of them earned less than minimum wage. According to the work conditions, the highest frequency of time as garbage collectors were between 6 to 10 years, and 24% worked between 11 to 15 years in this job, and 48% worked between 5 to 8 hours a day, and 45% more than 8 hours. So they have been garbage pickers for many years, and this job was the main source of income of these workers. When they were asked about the use of personal equipment of protection, most of them told us that they used at least gloves and boots, but we didn't see it when we went to the open dump to try to access them for the epidemiological survey. And 67% of the respondents said they had suffered some kind of accident at their place of work, and unfortunately, 92% of them didn't not open any work accident notice. And almost 90% of the accidents were related to cut with sharp objects, including glasses and needles. About the health conditions, the most prevalent chronic disease were hypertension with 34%, diabetes 10%, cardiovascular disease 7%, chronic renal insufficiency 4%, stroke 2%, and 37% of them told us they used some medication for these diseases. And according to the body mass index, 32% of the waste pickers were overweight, 14% had obesity grade 1, and 6% obesity grade 2. And about their life habits, 36% smoked and 32% consumed alcohol more than two times a week, and only 30% did some physical activity out of work. About the distribution of socioeconomic characteristics, 62% drank unfiltered water, and the waterborne disease more prevalent were dengue virus or Zika or chikungunya with 38%, leptospirosis only 0.68%, but diarrhea last month before the interview was 24%, and worms last year before the interview was 11%. And another disorder that was very prevalent was back pain, neck pain, and also legs pain because of the ergonomic risks. So, according to the blood exams, the values outside the reference limits were related to uric acid to 23%, creatinine 54%, GT range 16%, and glucose 35%. So now we want to publish our protocol of the epidemiological survey to try to monitor and also be a reference to improve comparative results around the world. And it will be very important to follow up with the collectors and their families and do other complementary tests like Hanseníasis and tuberculosis, including the metal analysis. And we want to do environmental assessment and monitoring with emphasis on water quality to do the correlation with the waterborne diseases. In the left picture, it was their work conditions when they worked in the open dump, and now they were relocated to triage centers, but the machinery didn't arrive yet. So they are working in transitory conditions. So we still have many things to do to monitor and improve their health. Now we are trying to get some partnership to try to help these vulnerable workers and their families. It is not just a problem in Brazil, it's a global problem. And I would very like to thank you for your attention. This is the monitor of water quality about the groundwater, water surface, and consumed water that we want to do, and also construct an index of consumed water quality and environmental health. And this is our city, Brasilia. We still have good things to see there. And thank you so much for your attention.